Hey, my name is Kiana Lachey. I am a psych nurse currently in school to get my RN. I've noticed that there's been a consistent problem with dimensional analysis. So I thought, let's practice together because I actually enjoy math. I do really well with math, and I am just so willing to help whoever is willing to be helped. So if that is you, go ahead and grab your notepad and a pen, and let's get these questions done. All right, so in dimensional analysis, you always want to start with what's ordered first, and then you want to go and follow up with what is available second. In this question, we have a patient receiving hydromorphone at 0.8 mgs per hour IV infusion, and what we have available is 2 mgs and 2 mLs, and it wants to know what rate will we set the pump. So when you're setting the pump, it's going to be mLs over an hour. This is how the pump is going to run. So for dimensional analysis, we're going to set everything up so that we can see what needs to be crossed out. So we're starting with what's ordered, of course, which is the 0.8 mgs, and we're going to put that over the hour because that is literally what's ordered. Now we're going to follow up with what's available, and we want to make sure we are able to cross off these mgs, right? So with what's available in the mgs of the available form is the 2 mgs. So we're going to make sure that the 2 is on the bottom so that we can make sure those mgs are diagonal from each other, and then we're going to finish off the equation with the 2 mLs on the top. And you know that everything is set up because the mLs is on the mLs. We got the hour on the bottom, and those are lined up. And then we are able to go ahead and do our math. The mgs are diagonal, so they cross each other out. And now we are left with the hour on the bottom and the mL on the top, which is what we need because that's how we're setting the pump. So go ahead and do the math all the way through. And 1.6 over 2 is going to give us a total rate of 0.8 mLs per hour. So for the first question, the answer would be 0.8 mLs per hour is what the nurse is going to set the pump as. Okay, so for the second question, a patient is ordered 2 mgs lorazepam IV push, and available is 4 mgs and an ml, and it wants to know how many mLs should the nurse give. So we want to know how many mLs we're giving, so we're going to write that first. But in the equation, we're going to start off with the 2 mgs because that is what's ordered, and we always want to start with what's ordered. And then you can always put this over a 1 if it helps you visually. And then we're going to follow up with what's available. And because we want to cross those mgs off because we only want to end up with the mLs, we're going to make sure that the 4 mgs is at the bottom because we want to make sure that that is diagonal to what's ordered. And then we're going to just put that 1 ml at the top just so we make sure we're lining everything up properly. We got the ml at the top and the mgs cross off perfectly. And when you go through and do the math, you have the 2 over the 4, and 2 over 4 equals 0.5. And that is how much the nurse is going to give. So the nurse is going to administer 0.5 mLs of lorazepam to this patient. Hopefully you guys are following along pretty well. If so, go ahead and give me a thumbs up. Question 3. We're going to start with what is ordered every single time. And in this question, specifically, this patient is going to be receiving propofol and 25 mcgs per kgs per minute. And available is... Oh, there it is. Available is 10 mgs per ml, but the client weighs 198 pounds. So it just helps to write everything out first, or you can underline it But if you're taking a test, you are given scrap paper, so you are able to write these things out. So we want to know what rate will we set the pump. So that means mLs per hour. So we're going to start with what's ordered, always and forever. So we're starting with 25 micrograms per kilogram per minute. So we got some conversions to do, right? Because what's available is 10 mgs per ml, and we got micrograms right now. So we're going to have to do some conversion before we go ahead and do the available. So let's put mcg at the bottom because we know we need to cross mcgs out, and we need that diagonal from what's ordered. So there is 1,000 micrograms, right, in 1 milligram. So set it up like this every single time so you don't mess up. So now we're able to go ahead and cross off the micrograms, and now we're able to just deal with what's next, which is to convert the kilograms in the minutes. We're going to start with the weight first. So if we divide by 2.2, we can get this 198 pounds to be equivalent to the 90 kilograms that it is. So we're going to go ahead and put 90 kilograms at the top because it will be diagonal to the kilograms that is on the bottom. And you can always put a 1 if it helps visually, and then we can cross off our kilograms. Now we only have the minutes to deal with because we need to convert that to an hour. We need hour at the bottom and not minutes. So we're going to put minutes at the top. And we know that there is 60 minutes in 1 hour. So we're going to put 60 at the top and 1 on the bottom. That gives us a chance to go ahead and cross off our minutes. And now we are left with what we need, so we can put in our available dose. So since we have mgs left at the top, we're going to put mgs on the bottom because that's the last thing we need to cross off. And 10 mgs is what we have ordered, so that goes on the bottom. That 1 ml will go on the top. And now we can cross off that mg, and we are ready to go through and do our math completely because we have hour on the bottom and ml on the top, and that's what we need, ml per hour, in order to set our pump. So once you do all of the math all the way through, you should be able to come out to 135,000 over 10,000. So once you do the math on that, then you're going to come out to a total of 13.5 mLs per hour is what the nurse is going to set the pump as. All right, next question. We're always going to start with what's ordered. So just looking at the question here, we see that the order is 1.5 grams over 30 minutes. And it clearly tells us what is available, which is 1 gram in 10 mLs. I promise you, writing it out like this helps on your scrap paper if you struggle with doing the dimensional analysis. Get a pen, get a paper, and write it out with me as I'm doing it. I promise you guys the repetition is going to help you. So we're going to start with our regular 1 ml over an hour because that's what we got to set the pump with, mLs over an hour. So we're starting with this ordered, which is the 1.5 grams every single time. And it's telling us that it's 1.5 grams over 30 minutes. So you're going to write that out just like that. And then we see that we have some converting to do before we can go in and do what is available. So you can do what's available like I'm doing now, or you can do your conversion. So as you can see, I'm just going through and I'm writing what's available there. And then I'm going to do my conversion after I'll get rid of my grams. So I'm moving kind of quick here, ain't I? So this 30 minutes is going to be able to get crossed out if I put 60 minutes at the top over 1 hour, because I need to be left with just hours. I can't be left with any minutes. So I got my mLs over an hour, and I'm ready to go ahead and do the math all the way through, which will get me 900 over 30. So in total, I will be setting the pump at 30 mLs per hour for this specific problem. right, y'all, this is angle 2. So we got 4 micrograms per kilogram per minute. So this is going to be another weight conversion one. And then what they have available is 400 milligrams in 250 ml of D5W. Now we do have a weight, so we want to write all of our things out if that helps, or you want to circle them. So the weight is 176 pounds. So we have a couple conversions we're going to have to do. Let's get to it. It's asking us what rate will we set the pump? How many milliliters per hour? This is how you want to set it up, because this is how the answer is going to end. We're always going to start with what's ordered. So the 4 micrograms per kilo per minute. I usually, and not a converting dimensional analysis, I will go in with the available. You can too. However, I suggest you doing your conversions first, because it's just a lot easier so you don't get all mixed up later. You could go with the kilograms, or you can go with the micrograms. We're gonna go with the micrograms first, and to cancel this out, we'll have to make sure micrograms are on the bottom. There's 1,000 micrograms in 1 milligram. Isn't that nice how it's set up? With 1 milligram on top, because now we can go on with our available how we would in a regular dimensional analysis. As you go, you can cross out what crosses out. Micrograms cross out. Now we are working with milligrams and kilograms per minute. So available, we have 400 milligrams. So we're going to put the milligrams on the bottom, because we got milligrams up top up here and they need to cross off. So go ahead and put your 400 milligrams on the bottom, and then you're going to put the 250 milliliters on top. These cross off nicely, and now we have our top that we need, because we need to end up with the milliliters. But we still have to convert kilograms per minute. So we have 176 pounds. We know if we divide that by 2.2, we will get 80 kilograms. And since we have kilograms on the bottom, we need to make sure kilograms on the top so that they can cross out. So put your 80 up top, and then you can always just put a little 1. It doesn't apply to anything here, it's just by itself. So you just put a 1. And then those cross off nicely. But we still got minutes to convert, because we need to end up with hours, milliliters per hour, not milliliters per minute. So since minutes are on the bottom, we need minute on the top. How many minutes are in an hour? 60. And then we have 1 hour on the bottom. The minutes cross off, and now everything that's crossed off is crossed off and converted. We are left with our milliliters and our hour. Now you know you could go ahead and do the calculation across the board. That is going to leave us with 4,800,000. Yes, in dimensional analysis, your numbers will end up really big. Just keep going through, trust the process. At the bottom here, we got 1,000 times 400. That is going to be 400,000. Once we do the math, we end up with this beautiful number here of 12 milliliters per hour. Now, I do understand that there's a lot of people that can do it a lot quicker than this. However, the whole purpose of this video is for us to practice dimensional analysis in nursing, so that we are making sure we are always getting the answer right. And if you are able to do it this way, you should be able to do it your own way. And this is the way that I like to do dimensional analysis. All right, y'all, that is it for this video. I'm going to probably shoot to do like 5 questions per per practice. If you guys want more, I am more than willing to do more. You just have to let me know. And I thought that this was pretty good practice. So far, we're just going to lead with, you know, simple, moderate conversions, and we'll be fine. So when I'm doing these practices with you guys, I'm going to make sure I'm throwing in some complex ones as far as like the conversions go, because that's where a lot of people mess up for real. The more simple, straightforward ones, obviously the answer is pretty evident, but it is still very important for you to go through the dimensional analysis just to train yourself in answering the questions that way, so that you are making sure that you are always getting the answer right, and so that you're not also overlooking certain conversions that need to be made if you are just reading the question too quickly. So just slow down and take your time and make sure you're mapping things out this way. And of course, I will be trying to figure out ways that you can remember this when it comes to test taking, because I understand that test anxiety is real, and even though we have been doing this practice, it literally could slip your mind as soon as you get the test in front of you. But if you just know what it is that you are looking to end up with, you should be able to successfully go through with the dimensional analysis. I hope this video helped in some type of way. Next time, make sure you have your pen and make sure you have your pad, because we are going to be going through them together. I hope that you guys practice along with me, because we all know that saying, practice makes perfect. You just got to keep doing a thing until you learn it. It took me a minute to really grasp the concept of dimensional analysis, because I was doing it my own way, just being able to see the problem and just solving it. But I started getting certain questions wrong, and I'm like, what is going on? Because I am really good at math, I do numbers, so I don't understand how I'm getting it wrong. So once I started plugging the dimensional analysis into my nursing math problems for school, because I don't use it in the real world, we all know that, yeah, the rest has been history, because I have been getting them right. Just had my first test exam in med surg. I got about an 84%, got an 83.6, and I'm pretty proud of that score. There was some questions that I knew I overthought a little bit, and if I would have just not done that and picked my first mind, then I would have got closer to a 90. But I am still very happy with what I got nonetheless. And yeah, I only gave myself room to get 5 questions wrong. So yeah, I got 5.5 wrong. So yeah, not bad. Gonna be doing better next time, but we will be studying this dimensional analysis together. So make sure you guys stay tuned, hit that follow button, and hit a like, because it helps me out, and it'll also help the next person that needs this type of review and practice, so that they are acing their nursing math test. But yes, I'll catch y'all in the next video. Toodles.